Well, welcome back to another episode of Beyond the Smile, the podcast for the nonprofit Diversity and Dentistry Mentorships. I am the founder and your host for this evening, Dr. Layla Haishaw, and I'm so happy that we are able to bring together future dentists with dentists who are here to share information, resources, provide encouragement, and really just to help you succeed in dentistry and beyond. And this evening, I'm so excited to introduce to you one of my colleagues, a board certified pediatric dentist who is also a concierge children's dentist that we will learn more about, Dr. Nidhi Taneja. Sorry, I know
You got
Taneja.
this. That is correct.
Oh, I'm so sorry. But thank you so much, Dr. Nidhi, for being here and you're spending your time with us. Definitely as a pediatric dentist, there's so much that we can learn from you. I mean, we've had a lot on, and of course, that's my favorite specialty. But what you're doing now in dentistry is really shifting that paradigm kind of from that traditional dentistry to more of a prevention focus, minimally invasive. So I thought this would be great information to share with our mentees, some who are in the pre-dental stage right now, and some like a mentee that we have on the line now who's a dental student, and to see what options there are in dentistry. So I just was hoping if you could just share a little more information of your background and how you got to dentistry.
Of course. Thank you so much for having me here. And I've always enjoyed talking to you offline, but this is formal. And I'm so excited that you're doing this for helping all the dental students. I certainly feel very passionate about helping the new dentists coming up to see different models of dentistry. And a little bit about me, I grew up in India, so I was a dentist in India, and I moved to States about 10 years ago. I went to UCLA, and then I practiced as general dentist before I went into residency in Connecticut. So one thing that I learned different in India versus United States was the level of dentistry that was practiced. Of course, in the United States, there is dental insurance, dental studies are so expensive, dental treatments are so expensive. But I always knew that I wanted to go into prevention because one, I love kids, to treat them at that most budding stage. What I observed in India is that we didn't really do a lot of aggressive treatment. One, it came from a financial perspective where parents would be like, this is baby teeth, they will fall out, why do we treat them? And even me as a growing up, I did not go to a dentist up until I was in the dental school. So when I studied in United States and we did preventive dentistry, it just made so much more sense, and like my worldview expanded into understanding that, oh, dentistry could be this way. But then when I became a dentist, completed my dentistry and started practicing, I realized that dentistry is very heavily driven by insurance models. So it's very procedural. If you are talking to the patient, you're not making money. If you are preventing the disease from happening, you're not making money. And with all the student loans, with everything that exists, I think it became a rat race to produce more. And I joined a DSO, and they were really not influencing my decision making, but the incentives were made such. And new dentists coming out of dental school, we didn't know a different way. So I think the two very varied, different experience for me, one from India and one in the United States, and just seeing teeth in general for kids. You may see in your practice that when a child comes to us, sometimes they have bombed out teeth and they're not even in pain. So it got me thinking, and also with the newer studies with SDF and fluoride, I just felt that I wanted to get into the minimally invasive world. And now I have made it a point to give all patients, all parents that option if it is a viable tooth and they're not in pain and the decay is away from the pulp. I want to offer them that treatment. So yeah, just a little bit of perspective of how I got so much more confidence in practicing that, because in dental school, I remember in my pediatric residency or pediatric rotation, I actually failed my exam because I didn't plan a class 2 in a very incipient lesion. So, or a crown, actually. I planned a class 2 and not a crown. So I think we were trained in a way to be more aggressive for a reason, like we need to identify decay early. But
Right.
I think in real life, dentistry is so different, especially in prevention.
Yeah. Can you explain to the audience SDF, the silver diamine fluoride?
Of course, yeah. So silver diamine fluoride is a newer amongst in the last decade or so. It was more popularly used outside the United States, but recently it has gained popularity. It's called silver diamine fluoride. It freezes the cavity. That's how we explain to the patients it's topical or medical management of caries versus surgical, which include drilling and filling. What I explain to my patients sometimes or the parents is that if you had an acne scar on your face, are you going to go for a full plastic surgery, or are you going to put something topical, help it remodel, help it not grow bigger? So it's like a topical antibiotic, I almost
Mhm.
call it. And it the only downside of it so far is that it turns the carious lesion black.
Yeah.
But I have seen a lot of parents agreeing to do it if you explain to them in the right way. And
Mhm.
as the child grows older and we gain more cooperation, it helps them to, one, not be scared of going into an invasive procedure. And for parents, sometimes it even avoids going into general anesthesia. So I think just maintaining, buying that time and gaining the cooperation of the child, even financially, it is so much more affordable for parents. So I do that a lot. And I think you mentioned about concierge dentistry.
Yes.
And that's more like an in-office or in-home dentistry. So
Mhm.
I offer consultations and SDF at home when the child is super scared of going to the
That
dentist.
is great.
Yeah, I think we can manage so much more. And my mission is that no child should ever be afraid of going to the dentist. So whatever we can do. So when I see a child with autism or special needs or who has had a bad experience in the past, I
Mhm.
just offer to them. And some parents are really surprised, but it's such a useful service.
No, I want everyone to follow you on Instagram. Just watching your videos, the amount of nurturing that you provide and care and patience is truly changing a life. And you could just see like the parents in the background just stunned and grateful. I think it's so fulfilling to see what you're doing. And also I heard you on another podcast when you're saying some of the greatest gift you can give is when you can realize that you can't treat this patient and then making sure you're either referring or you can give them the tools. And so I think that's really important for some prospective dental students to know that this is there's not enough specialists and not enough pediatric dentists to treat all the kids in the United States, though. So we do need the general dentist to be trained and get the education and background to be able to learn what silver diamine fluoride is, how to manage behavior. So you're educating thousands and thousands of people. So keep up
I
with your
love
work.
that because I think the newer generation of dentists are going to actually, if more of the general dentists can start feeling comfortable seeing the
Mhm.
kids from starting them to see at age 1 knee to knee exam. And there are so many beautiful courses that CDA has put out where
Mhm.
they're literally walking them through for 0 3 how to manage a child. And all dentists, I think, can do that. And if we can just sit down and spend that extra 5 minutes with the parents to help them understand how important that
Mhm.
age is for them and give them a perspective that how important it is for them to take care of the teeth as a young baby. It's just very rewarding, like you said. I think that
Yeah.
patience and nurturing pays off for the parents more than anything.
For sure, for sure. Now, Dr. Taneja, can you also share your appreciation and love for meditation and mindfulness and how you're incorporating that into your practice as well as your daily life? And then also because a lot of our students here, they're in that process of preparing for the DAT and they're studying and maybe they're managing, balancing, working, school, and studying. Or we have some dental students too who are managing all of that as well. How can mindfulness help them and make a difference in their success?
Thank you for asking that question because I think my first passion is dentistry and then my other passion is mindfulness. And
Yeah, we're multi-passionate.
I call myself the mindful dentist. And I honestly, I think that came about because I do incorporate that awareness when we see a child. I feel like we connect to those little souls because they're so innocent. And you can tell that if you are in a different zone, if you're anxious or if you are thinking about something else or the next patient or a review or a staff, it automatically brings that stress to that appointment. And when you're talking to the patient, it will bring out and you're not going to be able to do your best. So I think mindfulness or meditation for me brings me in that moment and awareness constantly when we are facing the stressors of life, which are invariably going to happen.
Mhm.
And I recently read this article. It talks about um, depression and anxiety. And depression is when we are thinking about the past events and that are not in our control.
Mm.
And anxiety is about a future event that is not in our control. So ultimately, what's in our control is this present
Present.
moment. So I always tell any DAT student, any sometimes even my assistants and my parents, like we see them being stressed out, and I almost love when an assistant comes to me and tells me that this appointment is going really bad because mom is XYZ.
Right.
Those are my favorite appointments because I get to pause and really connect with the parent that what is actually going on. And, most of the times they're just worried about their child, or they've been going from one doctor to the other with different opinions. And something to just remember for students is that keep the bigger picture in mind. You guys are all doing amazing with doing study clubs, attending after-hour classes, doing labs, and there's endless amount of material available on social media now. I think in our times it wasn't there, but when you see the other person doing so much, there's
Yeah.
added pressure, of course. So as long as you're really true to what you want to do in your career and which specialty you want to pick, or just what kind of a dentist you want to be,
Mhm.
cut off the distractions. Everybody's path is going to be so different that it's important that if you face a situation, take 10 minutes time off, just evaluate, breathe through that stressor, and just kind of keep going basically, and seek mentorship. Definitely seek mentorship. I think that's such a key to have a mentor figure. So whenever you're low and whenever you're doubting yourself, you have a good group of friends and parents and mentors around you.
Oh yeah, for sure. I mean, and having just even a network of friends too in this going through the same, you realize you're not alone. But mindfulness, I mean, yes, is I think more people are understanding it. But it can help with the stress because I find myself too, with the parent, or we always refer to parents because we're in pediatric dentistry, but those are the ones that usually give us the stress. Dealing with the kids would be piece of cake. And automatically, if they're, wanting, not accepting the treatment plan or whatever, then I automatically become defensive. And then right there, that becomes an issue versus what I'm hearing from you is just almost being empathetic and putting yourself in their shoes and realizing not to take it personally, whatever they're going through, but just to kind of recognize what it is and to feel and be able to communicate in that way, by just addressing their issues, not issues, but concerns, so that you are then present in it to help treat the patient.
You nailed it, because one of the characteristics or qualities of mindfulness is non-judgment, and
Okay.
that comes when you are faced with a situation to not judge that situation.
Mhm.
But it first starts with not judging yourself. A lot of times we have so much going on in our own mind that when we go to that appointment, we already are stuck with our own preconceived notion. So
Mhm.
when the parent is telling us something, we are already have a story before they actually tell us.
Right.
I don't want fluoride. Okay, we know who you are, right?
Go for it.
So
Yes.
I think it has given me a lot of perspective and a lot of praise from the parents. Actually, they can tell, like, but they would accept the treatment as long as they understand it, or sometimes you let it go. So letting go is the other one. So
Mhm.
non-judgment, trying your best, but then letting go of sometimes situations or people not being in your control. So
Mhm.
giving them that freedom.
Well, yeah, yeah. I would even see how, definitely for our students of color who sometimes are faced with certain microaggressions and biases, that it is very hard at times, but then when you're realizing that where you are in the situation, not to take that on, and to address it in a way that is going to be healthier than letting that eat away at you and cause more of the imposter syndrome that you don't belong and all that. I think that would be a great practice. Do you recommend any apps, or if someone's new to this, and what can
I
student do?
love Calm app. I
The
think
Calm app?
it has 10 minutes meditations, and it's probably the most relaxing. I don't make rules around meditation.
Mhm.
It's what feels right to you. Any kind of meditation that speaks to you, I think works. Some people say you have to sit in a posture, you have to do 20 minutes, you have to turn the lights off. I think close eyes, open eyes, these are all your own rules. They say the best kind of meditation is the one that you will do. So create your
I want to ask you about toothpaste or toothbrushes. Yeah, which toothbrushes? The electric toothbrush or regular, like the one the kids can
the
use?
one you're gonna do. Yeah, exactly. That's a good one.
Yeah.
But I think it's just important to take out that time. It could be in the morning, it could be right before you're leaving to go into the school, and just in your car, right in sometimes in the shower you can do it, sometimes while eating breakfast. So just
Yeah.
pausing for 10 minutes. I love Calm app, but there's Headspace, there's Insight
Yeah.
Timer.
Mhm.
There's so many, but for me, I think Calm has just this perfect balance of choosing the time limit, and
Okay.
also for healthcare professionals, they give you a free year or something like that. And
Oh,
if you have
okay.
Kaiser, it's almost free.
Yeah,
So
I've been using Headspace, but I'm not as consistent. Like I know I just need to be, but I do
don't
like.
be hard on yourself. As long as you know that it helps you, you will start gravitating to it more and more. And when you feel stressed, that would be your medicine. That
Yeah,
you'll be like, okay, I
no,
should be doing
yeah.
it.
I
And
mean,
you'll see the difference.
and I've learned really just finding my breath in those moments where I feel like just so much is happening, like in that moment, or I'm worked up about, or the assistant's worked up about a case that we're about to go into, or the parent and this and that, and I'm getting nervous. I just have to just center myself and just that deep breath.
Breath is your friend for sure. And I just want to
Yeah.
add one thing for
Mhm.
you mentioned the students of color. I think I, being an international student, faced something very similar where I always felt outside, but
Mhm.
I don't think I've faced that up front. I think I was so centered in myself. Looking back, I feel like I didn't allow myself to be exposed to somebody else's criticism because I
Mhm.
gave myself a lot of grace. I'm like, I'm new in this country. I'm doing enough, you know. So if ever somebody feels left out, I always tell them, create your own boundaries for your space, what you need. I think you are your own best friend, and you don't nobody else will take care of you the way you do and your own community does. So making sure that there's going to be every kind of situation that we will face outside, but as long as you're centered within and you know that your core and your intentions are correct, nothing else matters.
Oh, I felt that. Oh, I felt that. I know the mentees will too. Thank you. Thank you so much for sharing that. That is so important. That's so important. Oh
Because you
man.
know your own truth. Nobody is
Yeah.
walking in your shoes, you know, and
Mhm.
I allow people to not understand me sometimes. The use of English language for me, I've learned so much from my patients, and sometimes they would correct me on my pronunciation of words, and I would just be thankful. I'd be like, great, I'm learning every single day, and I have unique talents in myself. Our own struggles are our biggest strengths, so always remember that.
Oh, that's great. Oh, yes. Where's the book? You need the book. You have so much to teach us. Yeah, well, speaking of, well, I should check too. Any questions, feel free to put them in the chat, and also, I didn't put my phone. I was going to check the YouTube chat, but definitely as this goes up, everyone can come back to it and reach out. They have questions. But I was going to ask, what other projects do you have coming, and what's in the works for you?
You know, I have just recently developing my other site called Playtime Dentist,
Mm,
and it is more focused on the house call. So I think over the last year, I've been working a lot on just promoting my skills and minimally invasive part of it, but house call has not taken to the roads as much as I would like. So I think that's my bigger project this year. And also staying involved in APD and American Academy of Pediatrics.
Oh, great.
And I'm going to San Diego this actually right after for the week for the grants committee, AAPD Foundation. I'm a board
Oh,
member on
great.
that. So just kind of getting back to conferences, traveling, and
Yes,
speaking
yes.
on mindfulness. I think everything is just running parallel, and
Yeah, we just kind
luckily the
of, sorry, no, I was just going to say we kind of just glossed over that, but you have such an extensive background in your leadership and top 40 of under 40 of dental specialists in Incisal Edge, and your research has been published. I mean, you have done so much, but that's very inspiring. It's very
You
inspiring.
are very kind, and I'm super inspired by you with all your
Oh,
accomplishments as
no.
well. With the book, I remember that I reached out to you with that. It's beautifully
Oh,
done, and
mm.
all the awards that you've been winning
Oh,
lately. It's
no,
such
don't
a
even.
pleasure to just know you.
Well, when we're doing what we love, then I feel like success will follow, and that's exactly what you're doing too. I mean, I feel like you've got it down, just the calmness and just the confidence and the giving back. Is there anything that you wish you could have known more when you were younger, or maybe perhaps what you would tell your younger self now, or maybe even a younger mentee coming
Yeah,
up?
I remember my time at UCLA when I was in dental school. I think I took it very I I there were these two spectrums that I was on. Either I was so overwhelmed at all times because I was just seeing other people doing so much in dentistry. And I remember even at that time, I'm like, I don't like doing implants. I don't like doing crowns. Like, I don't like aggressive dentistry. Basically, it just so I feel like knowing who you are and if something internally is feeling exploring that path. Like there is going to be a path for you. And that's what I feel my minimally invasive world. And I love it. That's why.
Mhm.
So just going with your passion is really important and not comparing yourself with what others are doing and or what other people have expectations of you is very important.
Yeah, definitely. Oh, that is great. Well, we are so grateful to you. I don't see any questions
I
right.
see a
Oh,
question
do you?
from
Oh,
Brooklyn. Let's see.
Brooklyn, go ahead. Let me see. Do you
How do
want
you
me to
balance
ask? What?
treating patients and traveling to conferences and speaking? Oh, that's a
Oh,
good
great
one.
question. Thank you.
Um, there is it's the balance that you choose for yourself. I think it is what you want to do. I think 5 years into practicing dentistry now, I have made it a point that I want to cut down my clinical days and start. I feel more confident to speak, and I think my passion has come to a point that I feel like I can teach or I want to spread that word to other people. And there comes a time where, like right now, I'm in that phase where I'm still gaining the momentum to use the right words to be able to express what I want to express in the least amount of words. But I think it's just an inner voice that comes in and you take that path. If something else is a priority right now, go for that. Like last year for me was really tough and I literally just shut down all the traveling and I think you allow yourself for doing that. And it's important to balance that personal and professional life and I think that's where that meditation and mindfulness comes in, where you are centering yourself. Life is a long marathon, it's not a sprint. And as I'm talking about it, I'm learning this myself. I was a sprinter, and then life gives you lemonade, lemons, and then you realize that it's bigger. It's more than dentistry, it's more than anything that you think in that moment it is. So life is just your personal journey that you keep on continuing on.
Yeah. And then also, I would just piggyback on that, because that's exactly true, is that sometimes we have to make sure that we don't fear that this opportunity is not going to return. Like if we don't say
Mm.
yes to something, we won't get it again. Or yeah, just a speaking engagement. I just recently had to turn down one, but a couple of years ago, I was just taking everything. And then my husband had to say, well, I thought you were doing this so you could kind of slow down and blah, but you're just more busy because, it was taking time preparing the lecture, the presentation, and then the travel and you're away from home. But yeah, now as you progress along, just knowing that you can make the decisions of what you want to do. And don't you
That
feel
is
like,
awesome.
yeah,
I think that is a key, the power of saying no. I think the first time you ever say no to an opportunity, you will realize how much ahead you already are. So wait for that.
it never fails, right? That you'll like, oh, I can just do this. I'll just RSVP yes. But sure enough, when it comes around, your no is you're saying yes is you're gonna have to say no to something you really want to do.
Correct. Yeah. Being conscious with your choices, 100%.
Yeah, absolutely. We have another either I'm not sure. Sonia, are you in a pre-dental student? Are you in dental school? You have any questions before we hi, she says hi. Any questions for Dr. Taneja?
Hi, everyone. It's so nice that you guys are getting this mentorship coaching from
We hope
Dr. Disho. I'm so happy that you're doing this.
thanks. I know where you said the huddle is like where we get the winning game plan because it shouldn't be a secret. We just learn, let them not go through our same journey with a little of all the speed bumps and kind of get through those a little bit easier learn from our mistakes and from our experience. Not always a mistake there, right?
Yeah, no, feel free to leave my Instagram handle and anything. I'm happy to help people
Yeah, I
offline.
see you have a mentorship. What is your mentorship program on your nurturing?
Mine is for international students, like those who are coming from India or other countries, because my path was very different. We didn't have to do DATs. We're dentists in a foreign country, and then we come here and join as a D3. So I coach some of the international students to become dentists in America.
Oh, that is great. That is wonderful. They're very lucky to have you as a mentor.
Oh, you're kind.
And of course we'll share this in the description of our the show notes. Where can our mentees connect if they have any? Just want to connect.
I think Instagram is the best. DR and my full name, Nidhi Taneja, or nurturesmiles.com is my website.
Oh, that is so wonderful. Well, thank you so much for taking the time just to share just your tips and tricks and knowledge and passion with us. I hope that I get to thank you in person soon. I'm not sure if I can make it to Orlando, but I'm trying.
That would be awesome.
Right?
Yeah, Orlando, right? Yeah, I don't know either if I'm going there or not, but I hope to. We are like next door, so
I know.
It's not that difficult, but you always inspire me, Lila. Thank you for doing what you do, and it's such a pleasure that you are able to bring this community together.
Oh, we just hope it grows so that they know that anyone can succeed in any of the plans they have in dentistry and definitely beyond. So thank you so much for joining us. And everyone, just know that we have so many guests coming, so many episodes in the past that you can find on our YouTube channel, and also just to find us on Apple Podcasts, Spotify, and Google, so that you can be inspired inspired into action. That's what we're trying to do. So don't forget that we did it, so can you. Thank you so much. You guys have a great
Bye.
Bye-bye. Oh, wait, let me see one more. Yeah, thank you. Yeah. All right, you guys have a great one. Good night.
Good night. Bye.
Bye-bye.